Dear friends, I'll show you how to measure blood pressure with the mercury BP monitor. It is called mercury because it uses mercury column as a calibrated height we can see here to measure the blood pressure. It is measured in millimeter of mercury. So whatever the numbers you see here 10, 20, 30, 40, it is up to 260, 260, 280, 290 millimeters of mercury. But as we know, the normal range of the blood pressure should be below 140. Systolic blood pressure up to 140 and diastolic below 90. So we'll see. She is a known patient of mine. I am treating her for blood pressure hypertension. She had around 200 to begin with. I have started her drugs and we'll see now whether she has benefited with those tablets. I'll see her reading. We'll just see. This is a cup we used to we have this air bag inside, the rubber bag, in which we are going to put air by the use of this balloon. And this is a valve screw used to, when we do it clockwise, it closes the air passage, so the air won't go out from here. So whatever I push, the air will go inside this rubber bag. I'll just tie this. This should be such a broad and it should be tied. We can see this is known as cubital fossa, just in front of the elbow, and this is a biceps muscle. At the tendon of the biceps we can feel here brachial artery, and here and in the midline of the thumb, if we trace like this, we can see tendons here, and lateral to that tendon in this part of the wrist, if we press our tips of these fingers, we see a pulse here. So I can get the pulse here. So I can use this pulse or the brachial pulse, whatever I want to. First I'll just tie the cuff here. It should be at least somewhat distance away from the elbow, maybe 2 inches or above the elbow line. It should be in the mid of the arm, and it should allow one finger and not 2 fingers. So it should be that snugly tied. Yes, this is okay. Now we are ready to check the blood pressure. First I will keep my fingers on radial artery. I am getting the pulse. Okay, we'll put air inside this cuff. See, the mercury column is rising. I'll take it up to yeah, we have one about 200, and the pulse has gone. Now I can't feel the pulse because of the pressure. The radial artery, brachial artery, has stopped passing the pulse waves. So I'll just see the column here, and I'll slowly reduce the pressure so that the mercury column will be lowered down. Yes, and at one point, that point I'm just waiting for. Yes, now I'm getting the pulse. See, so she has systolic above 140. It is 140, 142, 142, 142 systolic. This is only by the pulse method, but by the pulse you can't see the diastolic blood pressure. For that we require stethoscope. If I will put a stethoscope at the brachial artery, and again I will do the procedure again. Now I know that she has systolic blood pressure of 142 around. So I won't raise the column much. I take it up to 150, and then I'll start lowering down to see exactly at what point, what reading. Yes, I am hearing sounds. Those sounds indicate, and at one point the sounds will disappear. Yes, sounds are diminished and have disappeared at 80. Okay, so we have got two readings. One is 142, which is systolic, and the other one is 80. So she has good control over blood pressure, but she has to be examined again at different hours of the day, so that we will know that she has always her blood pressure in that particular range. So 142 by 80 is acceptable at this moment. Now she is taking these tablets, and she has these two drugs, which is, yes, तुम्ही ह्या घ्या, चालू ठेवा. बरं वाटणार तुम्हाला. ओके ओके, विल सी हिअर अगेन. तुम्ही उद्या या, परवा या, तेव्हा परत ब्लड प्रेशर तपासून. ओके.